Atelectasis. In this condition, if you see, it is nothing but the part of the lung will be collapsed. There will be damage in a part of the lung, mainly in the alveoli part. And this condition, it can be just a collapse of the part or damage of a part, or else if there is any blockage, if that part is not working, if there is a damage, automatically the particular part of a lung will not work, right? And it can be varying from acute to chronic, or this blockage can be micro, that is small, or macro. And the causes of this atelectasis is blockage in airway is atelectasis, and apart from this, underlying health condition related to respiratory system can also cause atelectasis. For example, if you see, if a patient has pneumonia, then at the primary condition it's okay, but day after the day or month after the month, the patient's pneumonia condition will get severe condition. At that time, automatically their lungs get to damage, will get to collapse, and automatically blockage, and fluid starts to accumulate, and this blockage and collapse of the lung is known as atelectasis, and you know already. So if a patient has pneumonia in him, he can develop a condition known as atelectasis in a severe condition. If a patient has tuberculosis in him, he can develop in a later conditions atelectasis in him. So underlying disease condition like pneumonia, tuberculosis, pleural effusion, pneumothoraxis, these conditions can lead to atelectasis. And any kind of accidents or any kind of injury, pressure apply over the chest region can lead to chest trauma. So damage to the lungs is quite common one seen there. And chemicals, anesthesias using, or any kind of other drugs can also cause breathing difficulties and damage to the lungs, leading to atelectasis. And apart from this, lifestyle, the normal lifestyle like smoking, drinking, consuming lots of toxic substances, or working in a chemical factory, inhaling toxic pollutants can actually cause this condition. Sign and symptoms of atelectasis. Already the patient's lung is damaged and there is a blockage is seen in the patient condition. So automatically the respiratory system, the respiratory pattern is not going to be a normal condition. The sputum will be produced, and if you see, because of lack of oxygen supply, the patient is struggling to breathe. There will be a difficulty in breathing, and when the patient is trying to breathe hardly, then automatically the heartbeat will be increased, the pulse rate will be increased, and pain will be seen in that region. When the condition is getting severe and severe, then the infection and cyanosis is also seen. This is the sign and symptoms of atelectasis. Management is based on acute and chronic. So I think you are aware that atelectasis is generally seen as a secondary disorder. If the patient has underlying disease condition, then atelectasis generally occurs. So if the patient has any like pneumonia or tuberculosis, the treatment for that condition will be going on. For chronic or else the acute condition, the breathing exercise and ventilation, that is the oxygen supply, is the common one. And apart from this, for acute, we have a program, that is ICOF, that is regularly we need to perform spirometry test to see the breathing pattern and how the patient's treatment is succeeding, and breathing exercises and techniques will be advised to the patient, and that patient should repeat at least 3 times a day. And oral care should be maintained. Personal hygiene is very important. Apart from medications, this is a program should be followed for a better quality of care and better quality of treatment. And getting out of the bed at least 3 times daily, which means the patient need to stay active on alternative days or almost daily. Head to bed examination will be performed. In chronic conditions, if you see, surgical is the only thing, that is removing the collapsed part, and that can be performed either to bronchoscopy or a radiation therapy. This is the management. Questions will be provided at the end of the chapter. Meet you in the next video. Until then, stay tuned. Bye.